Biggest concern is those ultimately deciding what to cover and at what price won't be willing to make difficult trade-offs. Very exciting to hear that the state of New York is willing to give it a stab. We tend to be more willing to try these things out on our indigent populations. I'd like to see some more stringent activity on the commercial side, and what CVS is doing is promising. Greatest hope is that we will engage consumers more in selection of their health plans, selection of prescription drug plans, give them the option to select stricter formularies, and if they do so, then I think we'll see a market response.
So I live just outside of Washington, D.C., so I have lots of greatest fears. In this domain, it's that, and this is true in Europe, in Australia, wherever else you go, these issues around drug prices and access and costs and patient care, they're not easy. There's no system that feels like, oh, this is just a smooth process. We have a decision making. Everybody's happy at the end of the day. It requires the deepest effort of a society to really grapple honestly with trade-offs and with limitations around what we can spend and for whom. And that's never easy. And so my greatest fear is that at this particular moment in our political discourse and our public discourse, this will be really hard for us to handle. But my greatest hope is actually born out of some of our experience at public meetings, where we've seen patient groups really come to the table, not just for their piece of the pie, but seeing the bigger picture. And people starting to talk about this as an ongoing issue that we as Americans need to sort out, and hopefully in a way that will work for everybody, because cures are coming. You'll hear about them if you haven't already, but we're having some fantastic drugs nearing approval that will provide miraculous treatments for patients with long-term diseases like sickle cell, hemophilia. And if we don't figure this out, we're going to have a head-on train crash between price, cost, and access. So we have to get these systems and our dialogue sorted out, because we're going to have a great problem to deal with, which is cures for patients that we really want to help.
I guess my greatest fear is that the politics of Citizens United, which is money in politics, will come to dominate where we land and our solutions, because they often have in the past. My greatest hope is that we, I think, now have started to recognize how important competition is if we're going to have a market-driven system, and that we will sort of aggressively sweep away the things that get in the way of that right now, including, especially with on the biologic side.
Yeah, so my greatest fear also is that a lot of the things that we're talking about may require some legislative changes, grappling with patents, trying to evaluate the way that the government buys drugs, and that is problematic in the current, to get sort of these kinds of major things done in the current political environment, particularly when there is a extremely well-funded lobbying organization on the pharmaceutical industry side that is that actively opposes a lot of these kinds of changes. And so, but on the other hand, my greatest hope is the kinds of efforts that you see at the state level and that come out of patients, because there are surveys out there that 75% of patients think that drug prices are a big issue, and if we really see patients step forward and make their voices heard, I think that we can actually try to push through the gridlock.